All right, we're going to get started now. I want to thank everybody for coming. Welcome. I think this will be a very interesting and informative evening for us. As I mentioned to some, we're unfortunately competing against the big Phillies game tonight, so I apologize to anybody that is going to miss a little bit of that, and hopefully that our people that we're being live streaming this, and it'll be recorded as well, and hopefully they'll be watching as well. Anyway, we'll get started. Thank you for our candidates for all coming. To correct me if I'm wrong, my understanding is that we have 4 candidates for 3 positions, 4 county commissioner, 2 Republican, 2 Democrat. What we're going to have you do is everybody introduce yourself and maybe tell us a little bit about yourself, and we'll give you 3 minutes each to do that.
It's 3 minutes. Thank you so much. David Sommers coming from West Goshen tonight. Thanks for hosting the event. Thanks to the Chamber as well. Nice to be out with people this evening. So for 24 years, I've taught high school for the Archdiocese. I come to this election in a different point of view, or a different way, not non-political background. And so teaching high school for 24 years is very rewarding, and there have been some tough years, as we were talking earlier, regarding the years with the COVID and what happened to the students at Bishop Shanahan. I've been there for since 2011, I believe, or 2011, teaching with the diocese since 2000. And so this is an important issue. I was the union delegate during the COVID pandemic, facilitating between the Teachers Association and the school administration, and our COVID liaison contact with the county. Mr. Keller was the COVID liaison contact. So I had extensive work with him. We would meet several times a week to make sure things were going well, and if anything needed to be tweaked with the MOUs regarding the teachers and the students in the building. So I come about this in a way that's an education background, and it's just nice to be with everybody this evening.
Okay, thank you. We'll just go right down the line. Josh?
Hi everyone, my name is Josh Maxwell. Thank you very much for allowing us to spend time with you speaking about healthcare. Probably something that's on the forefront of everyone's minds in Chester County after the last 4 years, and to have an issue-focused venue like this on that, I think, is very important and valuable to the constituency, and we appreciate the Medical Society putting this together in that effort. I'm a county commissioner. I've been a county commissioner for 3.5 years, so I'm running for re-election this year. I come from Downingtown. I grew up in the borough of Downingtown, spent my whole life there. I was elected as Downingtown's youngest mayor back a long time ago when I was 26 years old, and spent 10 years in service to that community. During that time, I went to graduate school as a mayor and got my master's degree in public administration at Penn, and then worked for USAID on doing international development work in Mozambique, Nigeria, a little bit in Tunisia, and a famine project out of Washington, D.C. So essentially implementing Department of State contracts, trying to get parents to put their daughters in schools in places like Bauchi when they're worried about the Boko Haram and things like that. Previous to that, I made tables. I was a woodworker at a furniture store in Downingtown during college, spent my Saturdays and evenings making tables. So once or twice a year, I make some for charities still to this day to give my mind a rest on Saturday mornings. A couple of things we're very focused on here over the last few years is, of course, pandemic response, working with our hospital systems, working with the state health department, working with the county health department to get masks and vaccines to everyone in Chester County who want to take advantage of those opportunities. Had wonderful partnerships with Medical Society and practices throughout Chester County to help get those vaccines out, and we appreciate it. But also transportation, environmental issues, and I look forward to maybe just briefly touching on those things as we weave in how we're helping to bring hospitals back to Chester County that we've lost.
All right, thank you.
Good evening, everyone. I'm Eric Rowe. I am a former Pennsylvania state representative, and I'll talk about that in just a minute, but I'm happy to be here, and I'm running for county commissioner. As a state legislator up in the Pennsylvania House, in order to get anything done, you have to have 101 other people agree with you on whatever that is. In a chamber with 203 members, as a county commissioner, you only need one other person to agree with you. And so if I'm fortunate enough to win, I look forward to working in a bipartisan manner. The Board of Commissioners always has members of both parties on it, and so it's important to be able to work in a bipartisan manner. By way of background, I graduated from American University with a bachelor's in political science. Then I went to University College London, where I got my master's in public policy. I am from West Bradford Township. I grew up in East and West Bradford Townships and had the pleasure of representing them in the state legislature. I'm the father of 4 children under the age of 5. So we've spent our fair share of time in hospitals and doctors' offices. Any of you who have children know that you need to be close to good health care in order to have kids. And so that's why we live in Chester County, to have good access to health care. We're thrilled with the health care that we have. We want everybody to have the health care that we benefit from. And it's not lost on me that the hospital nearest to my home closed down. So that's concerning to me. That's concerning to hundreds of thousands of people across this county. As your commissioner, I want to work to address that and reopen our hospitals that have closed down. So that's me, and I will turn it over to Marian Moskowitz.
Thank you, Eric. Hi, I'm Marian Moskowitz. I live in Tredyffrin Township, and I have been a resident out here since 1984. So I'm going on 40 years. I have raised my 5 kids and now have 5 grandchildren here. And I have been in numerous businesses. I'm a true entrepreneur, if you will. I've been in various businesses: trucking, cosmetics, mobile kiosks, import, export business, and real estate development, mainly in Phoenixville. I came into this role just as COVID came. I always say that Josh and I came with COVID. We all came together. So it's been quite a learning experience, but I have really learned a lot about healthcare. That wasn't on my agenda for things that I would learn and grow in the role, but I really have, and mainly because it was thrust upon us with the hospitals closing and COVID coming, and I really learned to appreciate much more the value of the good healthcare that we all take advantage of here. We just assume we'd have it forever until one day you wake up and you don't have it. So I think that we have been in the county a strong advocate for health care, certainly working on hospitals and things, and I would love to be able to continue that work. Thank you.
Thank you all. They're very impressive credentials for everybody. Obviously, as you can tell, the focus that we have is on healthcare issues in the county, and our questions tonight are going to focus specifically on that, though there's plenty more things that the county commissioners have to look at. The format tonight is going to consist of several questions which will be asked. A list has previously been provided to everybody, and you'll have another 2 to 3 minutes to respond to each. We will ask to try to keep your answers to that time frame. Unlike the presidential debates, we won't have rebuttals, so don't have to worry about that. All right. We'll get started now with the first question, and that is that the number of people dying of accidental drug...
Dr. Bobman, can I just say something?
Yes.
2 things. First of all, for people in the audience, we do have index cards, so if during the presentations you have any questions you come up with, if you could put them on the index card and give them to me or Dr. Spidell here, and then when we get to the Q&A, we can kind of pass those up to Dr. Bobman. And if people do run over time, I'll probably hold a deal.
All right.
That's it.
Thank you, Christina. You can tell who's really in charge here. All right. First question, number of people dying of accidental drug overdoses in Chester County has shown little change in the past 5 years. The county is receiving $15.5 million over 9 years from the opioid settlement agreement it joined in 2021. How would you, A, allocate those funds between prevention, treatment, and survivor support programs, and B, include the physician community in planning or administration of those programs? Marian, I'll start at your end for this.
Sure. I think that we have put together an entire strategic plan on what to do with those funds going forward. And so some of that I'll focus on prevention and education, which I think helps at the early stage so we can prevent people from being in that situation. So we are doing things like developing, supporting, and expanding evidence-based prevention programs for K through 12, which is really awesome. There aren't many programs like that, but we need to start very early. Supporting Be Part of the Conversation, which is a family support and education initiative. I think that's really important. I had it in my own family, and I did not know what to do. It just was something that occurred all of a sudden without any training. There was no place for me to go. So I think those things are really, really important for families that are trying to deal with a lot of this. Promoting medication safety, that is really critical. We have lock boxes and pill pods. We have all kinds of ways to dispose of these medications safely, but a lot of people don't know about it. So we need to market that much better and to a much broader audience. Certainly raise awareness through community groups, faith-based organizations, school groups. We have some pilot programs. One of them is Gateway Works, which is an equestrian program, which we use at the prison, actually. And the people use the horses, they take care of them, they talk to them. It is really therapeutic, and it is a very successful program at the prison. You can walk around and see people just caring for the horse, but also confiding in the horse. And it's a really great way of having a friend if you can't talk to people. So we're doing a lot of that kind of thing. We certainly work with the medical community, and certainly our MHIDD, our drug and alcohol department, we always have people that are physicians on the board or part of committees, because we don't know everything, and we have to bring people together constantly to make sure we're heading in the right direction. I hope that answers your question.
Okay. Thank you. We'll go reverse order.
Sure. So drug overdoses are heartbreaking. I graduated from Henderson High School here in Westchester, just down the street, and I can't tell you the number of funerals I have gone to of my classmates in the graduating class at Henderson High School, of people who just were here one day and the next day they were gone, and it was from a drug overdose. One day you run into them on the street, you get to catch up with them. One day they're your server at a restaurant, and then the next day you see on Facebook that they passed away from a drug overdose, right? You didn't even know they were struggling with that, and you find out that you have a funeral to go to the following weekend. That's heartbreaking, and I'm not the only one who's experienced that. A lot of people have loved ones who have passed away from drug overdoses. As our county commissioners, there are things that we can do to prevent that, right? And we've got this money that we need to spend wisely to ensure that it goes to the right places. When I was a state legislator, we voted on a bill to essentially change the workman's comp formulary to put reasonable limits on the amount of opioids that are covered under workman's compensation, because 1 out of every 4 addictions for opioids comes from an accident at work, right? People just go into work, have a slip and fall, and then they're prescribed more opioids than they need, and next thing you know, and I don't have to tell that to you, you're doctors, right? You know more about this than I do, but they come away with an addiction that ultimately takes over and ends their life, right? How would I allocate these funds? So an ounce of prevention is worth more than a pound of cure, right? So I would say 40% for prevention, 30% for treatment, and 30% for survivor support programs. Now, a good leader knows what he or she does not know. I know that I'm not a doctor. I didn't go to residency. I didn't go through medical school. I don't know more than you do on this. It should be a crime to do anything that affects the medical community without consulting the medical community, okay? And so as your county commissioner, you better believe I will pick up the phone and call up the medical society and ask questions, because I won't have all the answers, but I know where to find them, and that's my intention if I win.
Okay, thank you very much. Josh?
Thank you. The opioid deaths in Chester County have been remarkably consistent, as you pointed out, between 103 and 109 over the last 4 years. So we're on track to pretty much land in that range again this year. Marian very eloquently spoke about some of the prevention things that the county's working on. I'm going to talk a little bit about some of the treatment things that we've been focused on with our staff, and they deserve a lot of credit for this. One of the things we started just this year was providing medications for opioid use disorder at the Chester County Prison for people who are addicted to opioids, and we're using some of that $15 million you mentioned for that program, and then connecting them to services before they get out of the prison, making sure they're signed up for Medicaid or other services they need and connected to a provider once they're outside the facility. We're providing substance use disorder training for all Chester County Prison staff and the management there, recognizing the importance of addressing stigma within the criminal justice system. People need to understand what this medication does, how to handle it carefully, and make sure that we're educating the prison population on what this does. We're expanding and providing support for the use of naloxone, increasing access, educating the community, and promoting Narcan throughout Chester County, and just doubling up our efforts on marketing that, getting more folks trained, so that if they have a friend or somebody that needs it, they can implement it, or if they have a child, heaven forbid. We're addressing some of the needs in the criminal justice involved persons. We're supporting 2 new certified recovery specialist positions embedded in specialty courts. We're also increasing drug testing in probation, parole, and the coroner's office, getting more data on how prevalent this is in our community and making sure we're connecting those people to recovery services. We're also expanding a warm handoff program. And this is going to be a referral program to PCPs and OBGYN providers throughout Chester County. In terms of, I'm watching you, Dr. Vanderpool, just in case you put that card up. Feel free to shut me down. But we are, in terms of bringing the medical community into this, Marian and I updated the budget system now, and we started with our American Rescue Plan dollars and how it was spent by getting more smart people volunteering on review committees for the county, and then advising us on how to spend taxpayers' money in an efficient and effective way. So we did that with ARPA funds, where we had volunteers, retired CEO types, anybody who was an expert in a particular area, volunteer, score applications that we got just like this, and then recommend them to the board. Our budget's going to work that way moving forward. So as county tax dollars get spent, we're going to be soliciting input actively on an annual basis on what the community wants to see, just as much to learn what does not work. If something's, we started something and one of these things I talked about isn't working, we want to stop it and pivot to something that we think might work with more information, with more of the data that we provide. And we certainly need doctors and people from the medical community globally as part of that process.
Okay, very good, thank you. David?
Yeah, it's a tragedy, and it's a tragedy that affects us with the young folks as well. I'm done already?
No, that was me.
You yield your time. It's a tragedy for the young folks as well. Working in the school system, I can tell you, it's very difficult. And education, preventative measures, proactive, all the folks talked about are the way to go. We can do more to be proactive, and then we don't get to these situations. The funerals, I've worked them because I work in the funeral ministry, as I would call it, but funeral business, and they are very sad, and they're very, there's circumstances that people take to heart that could be changed. So yesterday, so I think we could do this is kind of retreading what other folks have said. We have these great NGOs, non-government organizations, that are faith-based, some are not faith-based, Catholic Social Services. Yesterday I was with the Vine Ministry, and Pastor John Grillo does work. He was in Westchester Borough, and the Vine Ministry is helping people on the ground, real and tangible. Now, they don't get any county money, by the way. I asked, and they do not get it. So I spent an hour and a half with them yesterday afternoon and learning and finding out what works. Those are people who are on the ground who know what works. So we can network with those NGOs and the leaders in those particular positions and find out what works. And that would also be important to channeling those funds. Money for the sake of money is not my idea of success. I think we need to be what we would call here results-based standards in education. What works and what doesn't work, and that would be where doctors, as well as people who are at those NGOs, would make their cases, and we can get some data that says what is working for the money and what is not working for the money. Simply putting money into a program may not yield best results. Other programs may do better. That is where all of our community partners, our doctors, our pastors, our faith-based, our non-faith-based, we get those together in the room. we are not experts. None of us are doctors, and that's fine. My mother's a nurse, my mother-in-law's a nurse, my sister's a PA. They said I would never be able to be a medical person. I said, oh, okay, that's fine, that's great. So, but they know things, you know things, and it's our job to bring that effort together and get the best results for everybody in the county, because this is a really sad and tragic situation that's unfolding, and we can prevent perhaps a certain degree, and we could do better, and I think we can do better and we will do better going forward.
All right, thank you. Very nice answers. Our next question deals more with the COVID-19 pandemic, and that is based on lessons learned from the COVID-19 pandemic. How would you update or revise the county's emergency plans to include input from and consultation with the Chester County physician community in future disasters, including biological, radiation, and weather-related disasters? We'll start at this end and go back to the other.
Well, this one touches close to home. I worked through this at the schools, and I have to be honest, I think it was over-politicized. I think what happened was overly politicized, especially in the later years, not the first March 13th. Once we got through that third month and into the summer, going back into September, I could tell you the students were hurt, educationally, socially, mentally. They are still not back to where they were prior to the 2019-2020 school year. I saw it. I saw the county give directions that I felt were not helpful. I'll take it one break here. Mask breaks came from the state. First 10 minutes, last 10 minutes. Well, either you wear a mask or you don't, but there was this mask break that was given. Then the county changes it in January of 2022, because I met with our pandemic coordinator. I said, could I please have the paperwork to give to the union so we can let the teachers know what's going on? There's no document, there's no paperwork. That wasn't helpful to us in the trenches at the schools. We can say we did a good job. Our teachers were in every day in September of 2020. They did not get their vaccines from Chester County. They networked to go to Maryland and to Jersey because they didn't have any appointments. Those teachers were in every day working, every day, and they worked together as a team, and they were successful at going to everywhere but Chester County. I think that that is unacceptable in the wealthiest county in the Commonwealth of Pennsylvania. Our teachers were in every day. They worked, they were not able to get what they needed. The pandemic is over officially by the WHO, by the Biden administration. But as we know, 100 years ago, there was the Spanish flu, which was not from Spain, by the way, as we know, probably from the United States. And we know that other things will happen. I think we need to look at things, we need to consult, but we also need to take care of our most vulnerable. The nursing homes were the most vulnerable. Those situations there, and I was in those nursing homes doing, as we spoke earlier, the removals for funeral homes. I understand what was going on there. I went in there for weeks when we weren't in class at Shanahan. The students following these directions, especially at the end when we were having students in schools only masking and distancing, I would see these students on Sunday at Simon Jude Church. Everything was normal, and then Monday things changed. Folks, I'm going to tell you, the kids take the mask off as soon as they got in the car with 20 of their friends and driving off. They didn't follow it well, and it was exhausting for the teachers. We need to listen to the stakeholders. We need to say who are the most vulnerable. They need to be protected. If the students are affected again, we need to really think about what's going on. And sitting in a Zoom meeting in a basement or patting ourselves on the back for a good job does not cut it. Because the people who were working at ShopRite, Acme, the teachers, they deserved better.
All right, thank you. Josh?
Thank you. I'm particularly proud, I think the two of us that are currently on the board would likely agree with this. Working alongside the county health department, those folks working 12-hour days, 7 days a week during this pandemic was impressive. We spent a lot of time when this vaccine started trickling into Chester County, personally calling people and scheduling folks for vaccines who were waiting for months, not leaving their homes, who are in those vulnerable populations who didn't have access to them. And we're so worried about people jumping the line in Chester County, we personally called them from the 911 call center to get them in the next day. If we got 100 vaccines on Monday, we got 100 shots in arms on Tuesday of people that wanted vaccines. And I couldn't be more proud of the staff for organizing this response during such a magnanimous event in our history. Our folks, when it comes to I'm going to give you an example of our plan that I thought about. In our pandemic health response plan includes vaccinating, providing vaccines for people, and doing it at every single high school in Chester County. And that makes sense. Everyone knows who a local high school is, there's plenty of parking, there's a gymnasium, there's a cafeteria. In this particular instance, vaccines started to trickle in 100 at a time, 1,000 at a time, and doing a mass vaccination site at Henderson High School, Phoenixville High School, just was not going to work. An example of something being in the plan that in implementation was never going to happen. So we went out and bought a hospital, I think the Minnesota Children's Hospital, a vaccination scheduling system. Got away from the QR codes. You probably saw when you passed out the QR codes to people in your practices to make sure the people that are working for you could get vaccines. Those things end up on Facebook, and kids start shooting up to get vaccines in front of your staff, in front of your nurses. So we went out and spent a lot of our CARES money on this program so we can get people scheduled faster. And now the county health department has this program, and that's how they schedule flu vaccines. What I learned about having a plan is you need to be surrounded by a lot of experts for when something goes wrong. And you have to plan for the unexpected and be prepared financially and with expertise to pivot as quickly as possible. And I'm so proud of the response here in Chester County. I think the health department vaccinated over 300,000 people doing them as soon as those vaccines got in. It was a lot of work, and just God bless them. And that's my answer.
So I'm glad Commissioner Maxwell mentioned just calling people up during when we were trying to get vaccinations out. So I was working in the commissioner's office at that time, working for the Minority Party Commissioner, Michelle Kickline. And I think I was in the basement of the GSC with both of you making those calls. I will never forget the relief on the other end of the phone when you pick up the when they picked up the phone and heard our voices on the other end saying, "We're calling to schedule your vaccine appointment." I actually ran into one of the gentlemen who I called recently. I ran into him, but his son was is a paraplegic, and he was terrified and immunocompromised, and he was terrified that his son would catch COVID. And we called, we got him set up. His son went up to Kimberton to get a shot, and his son never ended up catching it, and thank God he didn't. But I'll never forget the relief on the voices of parents and the elderly who were just desperate to get that vaccine. Information is power. When you have it, you're empowered, and when you don't, it can breed fear. Weather-related disasters, pandemics, biological disasters, pipeline issues, right? You name it. If you don't know what to do in an emergency, it can be terrifying. We've got people all over this county who want more information from their government. One thing that exposed a weakness in county government recently was the escape of Danilo Cavalcante from the county prison, right? There was a need for better communication to the local residents in Pocopson Township and surrounding townships around that prison. People wanted more. They wanted to know more information, and they wanted to know it much sooner than they got it, and up in northern Chester County as well. Whether it's a pandemic or any other type of emergency, as your county commissioners, we need to be getting timely information to the residents of our county, to the taxpayers, to the voters, to anybody who is in our county, whether they reside here or they're just passing through. There needs to be better communication so that there's less fear, so that there's more confidence. As your county commissioner, that's what I'm going to focus on.
Thank you. Marian?
A lot of it's been said, but I think there are a couple highlights for me where we were actually really working with the medical doctors, the hospitals. One was giving vaccines. Chester County Hospital was by our side the whole way when we were giving them in Westchester University, and that was a great, great partnership. We had paramedics there, we had volunteers from the volunteer community, doctors, nurses. I think we worked really well together to bring as many vaccines as we could to the population. And I would also mention that we worked with EMTs and doctors to bring a mobile unit out to actually go door to door to those homes where they were special needs, whether it be a handicap issue or a diabetic they couldn't get out or something like that, we went to their homes to make sure that they got their vaccines. So I feel very good about working with the medical groups because they've all come to the table for us. They have been here all the way, and I don't see that ever changing. Now, we may have a situation where our, what we call our COOP plan, our County Operation Emergency Plan, changes based on what the emergency is. I think that it held pretty well, and it includes a lot of people from a lot of different segments of life. I think without having partners at the table, and I'm a strong believer in public-private partnerships, we miss out on an opportunity because, as someone said, we don't know it all. I would just say that for me, and I'm not going to speak to Commissioner Maxwell, but I know I can talk to him on this. We felt the weight when that happened of 525,000 people. And you all have gone through it with your patients, with your friends. But I will tell you that that weighed on us day and night. And if we didn't have partners such as those that we had working with us, I don't know where we would be, because we gained a lot of knowledge from the people sitting in this room. And I thank you for that. So that's it.
All right. The next question is one kind of near and dear to my heart. It involves the access to medical care in the county. The question is, access to medical care in Chester County significantly decreased as a result of the closure of Jennersville and Brandywine hospitals. What direct or indirect measures would you take to improve access to hospital-level health care, including emergency and behavioral health care in those areas and in Chester County as a whole? Marian, you start.
Okay. Well, I think that we've learned how to grovel and beg to get that. Josh and I literally were on the phone with every hospital we could find that would talk to us to make sure that we were getting the best health care we could. And I know, Josh, I'll let Josh talk a little bit more about that because he was directly infected where he lived. I lived in Tredyffrin. I had Paoli and Chester County Hospital. So, but I would also say that we invested as a county $12 million into grants. 10 million of that is going towards the 988 mental health mobile crisis units, which I'm really excited about. We're going to have 3 of them. 3 will be during the day hours, and then 2 will be 24/7. And we're going to have social workers and medical providers on those to help divert a crisis should it occur. For example, if there's a crisis in the school and a teacher doesn't know how to deal with it, or the guidance counselor or the principal, that unit can go and take down that temperature, and actually, instead of taking that person to the emergency room where they do not belong, that doesn't get them the help they need, but actually get them the help, take them to a facility, an outpatient center, something like that, that will give them help. I'm really proud of that initiative. I'm very excited for it to start, hopefully by the end of the year, first quarter of next year.
Wonderful. Eric?
Probably one of the top 3 worst things that has happened in this county in the last decade is the closure of 2 of our hospitals. I feel strongly about that. I say that as somebody who lives near the Brandywine Hospital and someone who's got 4 kids and always needs to know where the nearest emergency room is. God forbid one of our children has an accident and needs to get to a hospital quickly. As a parent, that's on my mind because I'm a protective father and I want what's best for my kids, right? So as a county commissioner, I would make it my top priority to reopen those 2 hospitals that have tentative plans to open right now. But in government, there's always red tape. There's always bureaucratic hurdles to get over anytime you're trying to open or reopen a hospital. I had 2 great conversations. I sat down with the CEO of the Chester County Hospital and Paoli Hospital this year just to pick their brain on these issues, and I'm grateful for the time that they spent talking to me. So it's my understanding that in Pennsylvania, you're not really allowed to have a standalone emergency room unless you're in a very, very rural setting, right? So you would need some kind of a a dispensation from the state in order to have what Brandywine Hospital is planning for, which is moving the VA to Brandywine Hospital and then having a standalone emergency room that people can access if they're on the western side of the county. So there are some bureaucratic issues we're going to have to get through, and as your county commissioners, we would have to work with Harrisburg. I'm a former state rep, right? I would have to leverage every relationship I have got up in the state capitol in order to make sure that we're, getting that Brandywine Hospital emergency room open. Chester County and Paoli hospitals are picking up behavioral health patients. It's my understanding that there's been a 30% increase in ER visits after the closure of Brandywine and Jennersville. Paoli is the only trauma program in the county, but it's not equipped to handle those volumes, right? So this is not just an issue for those of us who live on the western half of the county. This is an issue for every single person in Chester County and even some of the surrounding counties, because when the wait times are longer, when transportation is much longer, imagine you have to get from West Grove to Chester County Hospital because Jennersville is not there for you anymore. That's a problem for everybody, okay? So as your county commissioner, I would make it my mission to remove any red tape that I could, and also to leverage the relationships I have in Harrisburg in order to work with the state government as well to reopen these hospitals and get people the health care that they live here for. People choose to live in Chester County, and they choose to remain in Chester County because they have access to good health care. There are people who live in, I think it's Freedom Village, right around the corner from Brandywine Hospital, who moved there so that they could be right next to a hospital. We owe it to them to reopen our hospitals and keep them open.
Thank you. Josh?
Thank you very much. Mary mentioned this big thing we were working on in terms of making sure we have these crisis teams. And that was a lot of feedback from our hospitals. And what's the county's role in behavioral health in Chester County? And we solicited a lot of advice before we committed $12 million. That's real money that we're spending on the street to make sure that people have access to behavioral health support services in the county. To go along with that, we worked with our folks at Penn Medicine on a new behavioral health facility on their campus in Westchester. As a 72-bed facility that's under construction right now. We found state dollars that we were able to pivot a little over $3 million towards that facility, and it's going to be the intake for a lot of those behavioral health patients. So they're not in the ER across the street, Chester County Hospital. Now there's going to be a 72-bed facility there. And just to remind everyone, when Tower Health closed Brandywine Hospital, we lost a little over 60 beds. With the new beds that are at Mainline Health and the 72 we're adding in Westchester, that's more beds than we had a couple of years ago. And we still have more work to do to support youth in this county, and we're hard at work as that as well. One of the things we really zeroed in on after this pandemic, and we saw Tower Health starting, the rumor started out they were going to close, they said they were going to close, and they didn't close, and all these things, is getting on our phone and finding high capacity providers that the community would actually support and visit. With Christiana Care in the southern part of the county, that area, the West Grove area, Generous Pond, Penn Township, they go to Christiana Care in Delaware. And the feedback was that would be a facility we'd like to have. That's a provider we wanted to have. And that's very important economically. It's an ER, it's a facility that people are going to go to. And we were able, I think it was about a year and a half ago, get the Department of Health through Senator Committa's office to change the regulations to allow for micro-hospitals and allow for an ER in a quasi-rural area, because that area didn't meet the definition of a rural hospital and they couldn't open an ER of that size. So we had to work with the Department of Health, and it ended up being a couple-month process, and we got that done. With Penn Medicine, when the VA announced they were closed, Penn Medicine reached out and said, we're interested in this. We're interested in this. We think Chester County deserves a Veteran Affairs here in Chester County. You have a need for an ER. Are you folks interested in working with us? We said, absolutely. The Coatesville area would greatly benefit from having a high capacity provider in that area that's going to exist for another 50, 100 years, and we're not going to have to worry about another hospital closure 10 or 15 years from now. We had a lot of people reach out in the interest of having some government money saying that we'd like to put a hospital there, but there was no reason to believe that hospital could exist long term. We're still in negotiations with them. We're still working through what type of county support is involved with that process, making sure that there are public access to the hospital when it comes, and they haven't closed on the property yet. The only people that have announced the Penn Medicine as the buyer is Tower Health, and we all know what that means. But we know, we get regular updates from the folks there. We're in constant communication with them. They know what we believe the community needs are, how important it is to have that employer in the Coatesville School District, how important it is to have an ER in that area where they haven't had access to some of the same health care that the rest of the county and rest of the region has for a very long time. And we feel very encouraged by the level of interest in the Coatesville area and putting a facility there in addition to saving the VA.
Very nice. David?
So access to health care is something everyone in this county deserves. They deserve it, and they should have it. And the fact is that in the south and in the west, they're not able to have that access currently. Christiana Care North at West Grove campus is not even open yet, and it's not scheduled to be open until 2024. I talked to folks from Christiana Care, and because of state red tape that was already mentioned, that facility is 2024 is the information that I received, and I don't think they have a date yet per se. There's a lot that's not in our hands to handle, but yes, the state gets in the way. So when that gets opened in 2024, we hope that should ease some of the what goes up to West Goshen, what goes up to Chester County Hospital ER, which they were able to add some extra. That's another question coming up about adding extra ER space and what you would do to change some of the zonings and help out with that process. So this is a situation that it's very complicated. The PA Department of Health recently did revise a lot of those regulations, and we talked about micro hospitals. There's also something called the freestanding outpatient ER department that they're doing. I was looking at one of those in Lock Haven, which is in the center of the state where the university is. So that is something perhaps that could work in some of our communities as well. The Pennsylvania Department of Health has authorized those, and the micro hospitals as well. The PACT money is what's going to be paying for Brandywine, or whatever they're going to call that hospital. It comes from the federal government, which is designated for veterans. There's actually nothing official that says they're going to be getting an ER for the public as part of that facility. And that is all hopeful, but nothing has been stated, as we said, in writing regarding getting an actual ER for non-veterans in the greater Coatesville area, and that's something that needs to be thought of, because when that was announced originally, I was talking to a lot of these folks. I work with them in Shanahan. They live out there, and they were thinking they were getting Chester County West. It's not going to be Chester County West Hospital. It's going to be veteran and maybe something for an ER. If that doesn't pan out, that needs to be addressed. There needs to be something, whether it's a micro, whether it's a freestanding outpatient, whether it's something that will address the need for that particular area to the west of Downingtown and west, I guess, over. So that's something we need to work on. The facility on Marshall Street, the former hospice, that is being converted over. That project is coming along very nicely. I was looking at that the other day. The Penn Medicine Behavioral Health Center is the former hospice center on Marshall Street, and I think that is going to help a lot. I think, again, education for young people as well. Our high school level students have been through a lot. If we can help them, we are looking towards the future. We're looking at our long-term goals as well. Something we didn't talk about was, I know Lincoln University, their nursing program just closed in June. We need to also find the next generation of doctors, nurses, physicians assistants, lab techs, you name it. So we need to start looking at training the next generation of people. We were speaking about TCHS and their nursing program for high school students. Gives them an opportunity to be active either in the morning or the afternoon session to see if they like healthcare. Right on the money.
That's good.
You're right on the money.
Very good. I think more training is going to be an important thing. This is, as you alluded to, this question is sort of a corollary to the one we just asked, and that is, in order to keep up with shifting healthcare needs and increased population, healthcare facilities in Chester County need relief from current restrictions on obtaining construction permits. As a county commissioner, what would you do to expedite needed healthcare facility expansion? David, I'll let you start.
So West Goshen did this. Chester County Hospital is mostly in West Goshen Township. The original little part is in the borough, but the additions and all the new and the parking garage is in West Goshen. West Goshen Board of Supervisors and the Zoning Board gave them a waiver or dispensation so they could do some extra ER work outside of the building, which was just added on not that long ago, and as we've said, it's already out of use. So I think we definitely would lobby for that, we definitely would make phone calls, we definitely would support that, because that is a very logical step, that anything that's in the way of expediting that process should be moved out of the way. Whatever the facilities need to get local residents the care they need should be expedited with priority one. So if it's something, although we do not have control of township ordinances, it would certainly be in our best interest for the people to make that work as easy as possible.
Thank you. Josh?
Thank you. As mentioned, local municipalities, whether it's West Goshen, Darlington Borough, West Bradford, or different, handle those permits. What we've done proactively with some of the projects I've talked about already is meet with those townships and understand their zoning and make sure we're communicating with the facilities coming in. Penn Township, where Christiana Care is going to be opening the hospital in the Generalsville area, hopefully, if things land, Penn Medicine and Cowan Township there, looking at this ordinance, communicating with the managers there and the boards there that are eager to help move those projects along. We incentivize our local municipalities to follow county-wide goals. I have found that everyone wants to be in their control of their own community, and that makes a ton of sense. So we have to come in very respectfully and humbly and encourage them very strongly to move these projects along just as fast as they possibly can. And if someone runs into an issue like this and believes the county can help move that project along, I would encourage them to reach out to Marian or myself. We'd be happy to facilitate a discussion to move a project along. We do it from time to time.
Okay.
Yeah, county commissioners have the ability to act as conveners, right? You have so many townships and boroughs, and you have all these municipalities, and some of them, like Chester County Hospital, are right on the border between multiple municipalities, and getting everybody on the same page can be rather hard if you don't have the right leadership at the top. And county commissioners can actually serve as those conveners who can bring people together and, if needed, use a carrot and a stick and say, look, your township receives so much money from the county every year. In order for you to keep getting that money, here's what we need, right? So that's, that is one of the powers of the purse of the county commissioners, is to, bring people together so that you remove the red tape, and that's just what I would do. I also just want to throw this out there. One thing that we've got going for us that's really good is our Department of Health. Not every county in Pennsylvania has a Department of Health, but we do. And we've got to keep that going as well as we possibly can, because we didn't know how badly we needed our Department of Health until COVID came along, and then suddenly we were really glad we did, and we were able to share that with Delaware County. I'm a Republican. I know that two of the people on here are Democrats and they're incumbents. I'm not afraid to say when they do something right, and I'm glad that you shared the Department of Health with Delaware County, because that was the right thing to do, whether you're a Republican or a Democrat. We need to keep our Department of Health in tip-top shape, fully staffed. We need to protect the greatest assets that we've got, and our Department of Health is one of them.
Marian?
There isn't much to add, except I would just mention that we have an amazing planning commission, and they work with municipalities putting together ordinances or things they may need. We help pay for the drafting of certain zoning ordinances or things like that, and I think that means a lot when our planning commission sits down and talks to the municipality and says, look, how can we work this through? What can we do? What can we recommend for you? How can we be helpful? I think we all know we can pick up the phone, but as someone said, you have to be careful. It's territorial in the sense that we all have different rules. However, we don't have a problem picking up the phone and calling somebody, but our planning commission does work closely with them, and they know what our strategic goals are for the county. Certainly getting more medical care is a strategic goal. And so I think that between them and the commissioners, you can make great headway, just talking to people.
Thank you. I learned a little bit about the workings of government in that. I did not know that.
Yes.
Sticking with the issue of access to health care, the next question deals with the ambulance services. Chester County's ambulance services and first responders are stretched to the limit, which ultimately impacts patient outcomes. What would you do to address this, Marian?
So it has been a real problem. The hospitals have felt it, the patients have felt it. We've been lucky that we haven't had a major catastrophe with it. Certainly when you talk about Jennersville Hospital, the ambulance had to drive 40 minutes to get to Chester County Hospital. If you have somebody having a heart attack, that is a major problem. We have done some things in county government. Now, we don't control emergency response, EMS, fire, those kind of things. That is a local level too, but we were able to do some things through our ARPA funds which helped them. We awarded grants for a new ambulance. We awarded grants for the community paramedicine program in Euclid Ambulance, which is a great program. We've put a lot of money into helping where we can with them. And I would just say I'm very proud today that we enacted an ordinance that gives tax relief, county tax relief, to volunteers coming in who live in the county, as long as they have to do certain levels, which they have to do for EMT and fire. And as long as they do that, they can get 100% rebate on county taxes. And we just did that this morning, and I'm really proud of it because these people are volunteering their time and they don't make a whole lot of money in general. So I think that's something that maybe we'll see some additional response from. But my daughter was a paramedic on an ambulance for a long time, and it's a hard job. It is a hard job. And these people that do it day in and day out deserve much better than they have had. And hopefully, I think it's easing up a little bit. They say it has. They have more ambulance. They do have more people. They're now going to the Jennersville area, is going to Christiana. So they're breaking it up a little bit. We're still overwhelmed in the hospital. Certainly in Paoli, they've added beds wherever they could, as did Chester County Hospital. But I think we had to go through a period where it was crazy till we figured out some kind of system for helping mitigate some of those issues.
So I'm not an expert in ambulance or EMS services. So I'm just going to throw out an idea that I have seen done in other parts of the country. But think back 10, 20 years ago, you had a lot of very small police departments around Chester County. And some of those have merged together to form regional police departments. You can do that with EMS and ambulance services too, where there becomes an umbrella organization that covers multiple ambulance companies and multiple EMS services so that they all have greater access to resources, right? Some counties, the entire county serves as the umbrella organization. I'm not saying that we necessarily have to go down that road, but I am open to having that conversation with our local fire chiefs and with our local, the folks who run our ambulance companies, right? I would like to get them all in a room and take their temperature and see, what do you think of this idea, right? Because we need to maximize our resources as much as possible. And so as a county commissioner, you can be that convener and have those conversations.
Good, thank you. Josh?
Thank you. Something I didn't expect being involved with county government is how organized and what strong advocates the EMS community here is in Chester County. It would not be unusual for an EMS chief in this area to text us or to call us late at night, call us first thing in the morning, and say what's going on in their community. They are very good at getting a hold of folks that can help them. And the manifestation of those conversations have been some of the things that Marian talked about earlier in terms of how we allocated our ARPA grants for the paramedicine program, the rebate program we did today for people who are doing the hard work of doing 20 hours or more volunteering in the community, both on the EMS side and the fire side of things. And when Tower Hill closed and the western part of the county lost ALS service, there were a lot of things we had to do to support the ambulance companies in there to restore some of that service in that area. So we weren't having hospitals coming from the main line out to Salisbury, back to Westchester to help people with the AL service, including helping Coatesville upgrade their system and Modena and some other ones out there. We have an EMS department at the county that meets regularly with these folks and finds just learns things that they need and tries to find ways that we can help, sometimes stepping out of the role a county typically would have with a local emergency services organization. A lot of that has to do with connecting people to certification training, testing, continuing education, hearing what they have to say and sharing that with the providers. Christiana Care and Penn Medicine have heard a lot from us on the EMS needs in those communities when they come in. They had a very strong relationship with Tower Health in those areas, the local EMTs, Medic 93, among other things in those areas. We want to make sure when these services get restored, the EMS does not get left behind. And those local first responders have a seat at the table to make sure that those needs are met in addition to the ones those providers are talking about.
Thank you. David?
So this is, for 2 years I've been going all over the county, and I always enjoy meeting our first responders and the EMS. The Euclid Ambulance Corps is fantastic. The young people up there are great. They did my blood pressure at one of the events, and I had none, so that was great because I was not alive, which is perfect. That said, I have some concern that everything is ARPA money, ARPA money, ARPA money. ARPA money's done. It's over. What are we going to do next? ARPA's a candy. It's over. The sugar rush is done here at the end of the year. There's no more ARPA money, American Rescue Plan Act money. So it's funding. So I've talked to these folks. The miles that they are putting on their ambulance to go from Modena to West Goshen, to go from Oxford to wherever, to go all these distances is adding up. And the miles and the wear and tear on these ambulances is unbelievable. So when you talk to these first responders and these ambulance and these EMS, you will see that they are getting, one, run ragged for time, but two, their vehicles are getting destroyed. It's a lot of miles and they need to cover, and they help each other very well. That mutual agreement in the Kennett Square area that was mentioned is very similar to, I guess, like a WeGo. WeGo is our police here in West Town, East Goshen, Thornberry. So Kennett Square area is trying to do something with that currently, and that's been in the Daily Local a lot. There's your plug, Daily Local. And so it's something to think about. The funding is going to be important. How do we fund and how do we help? The townships, some do better than others with the funding. So in the emergency Chester County EMS Council, they have some ideas regarding some ways of funding, be it perhaps a fire and EMS tax on folks who work in Chester County but do not live in Chester County. Simply $1 a week at $52 a year could raise approximately $2.6 million to go towards EMS. Now, the EMS budget for the county altogether, not the county, but the municipalities within the county, is about $42 million. But $2.6 million at $1 a week for folks who work in Chester County, use those services, but don't necessarily pay a direct fee, because they don't live in the county, so they're not paid that way. Perhaps another thing they suggested was some assessment on perhaps hotel rooms, $1 a night, or some fee that could be associated with your stay. You're here to see beautiful Longwood Gardens, you're here to say the history of our county, the different venues, perhaps that could contribute. That could possibly raise another, they suggest perhaps another $1 million. Those funds could be used to help because they are in need of vehicles, but also they are in need of funding to help to make this work. Because when we pick up the phone and call 911, nobody wants to get a, they're not coming, and that's just not acceptable. So there's going to need to be getting them in the room and working with them and discussions, and they do know what they want. I've talked to them. They have ideas. They're ready to meet, and we need to help them, especially with money.
Thank you very much. All right, it is 7:30. Do we have any questions from?
We do.
Oh, we're done with this.
Got a couple for you. If anyone else has questions they've written down, just pass them across the room or. It'll probably take you a couple minutes for these, so we can get in as many questions as possible. Did you look at it?
It's like free response.
All right.
Can you read the writing?
Yeah, well, I am. They're pretty extensive. I'm trying to figure out. Yeah, no, the handwriting's actually good. All right.
It's a little too on the nose.
All right. This one has the neatest writing, so I'll start with that one. Do you have plans to establish an advisory panel comprised of physicians and mid-level providers who are the ones actually treating opioid-addicted patients, to obtain input on ideas for opioid settlement distributions. It says, from candidate remarks, it sounds like basically the Board of Health members alone are advising. All right.
Sure, yes, why not? I think one of the things that we do as teachers, as a teacher for 24 years, is we see what works in classrooms, and we don't steal it. We borrow it, and we utilize it, and we take it in. There are people who have great ideas, and I love to take those great ideas, and I love to share great ideas as well, because what works for one school might not work. Let's take these ideas wherever they are, and let's meet with folks, and everybody has a stake, and everybody should have a seat at the table. Why not? Yes?
Yeah, I would be open to it. In my answer, I didn't mean to indicate that amount of communication stops at the Board of Health. What I was trying to indicate is we set up this process with how we spend county taxpayer dollars, where there's annual input we can get from the medical community on how we're spending money on anything that affects the medical community. And this is an ongoing thing that we've already gotten started. I'm sure there's a way we can get better ideas and include the medical community in how this money gets spent.
Okay.
I'm absolutely in support of having an advisory board on any medical issues. We have to have physicians telling us the things that we can't possibly know given our backgrounds, right? When I was a state legislator, I was 29 years old when I was elected, and I was placed on the Aging and Older Adult Services Committee in the State House, okay? So at 29, I didn't know what it was like to be a senior citizen. So what did I do? I reached out to seniors in my House district, and I said, we're gonna sit down once a month, and we're gonna go over these bills, and I want you to give me your input about what it's like to be, to be an older adult in Chester County, and give me input that I can then take to the Aging and Older Adult Services Committee. So I'm all about surrounding myself with people who know more than I do on any given topic, and our doctors are certainly in a better position to teach me than I could ever know myself on some of these issues.
So we have a large book of strategies for how we want to use that money going forward. And they do include, and they're on the website so you can look at those, but they do include who we're going to bring to the table for the various things, like the coroner's office for things, the medical world, and the health department for other things, MHIDD, behavioral health people. It's all laid out. It's very well done. And I think that you'll find that there are places for the doctors to be part of it, and as well as other professionals. So.
All right. I appreciate the short answers for these, because some of these have multiple questions on them. That's why I'm just trying to think back. So this is an interesting one. These are all tough to answer questions, everybody. Looking back on the pandemic, what surprised you?
That we had a pandemic? No, I'll tell you what really surprised me, and it was the strangest conversation. Jean Franklin, our director, our health director, came in, and I had only met her once before, and she said, hi Commissioner, welcome, but I just want to let you know that I think that this virus that's coming across is going to be a pandemic, and I'd like to start preparing. And I was like overwhelmed. We have an amazing team, and I will tell you that when I look around the state at how everybody handled it, we were so lucky to have the department that we had at that moment in time. Because when I looked at, we had to fight for vaccines, and we had to fight for everything that we got, and without that data and those people beside us, it would be really, really hard. So that's my answer.
Eric?
There are too many things that surprised me to choose just one. I wouldn't say that this surprised me. I think it confirmed something I believed but had to see with my own eyes. Just the goodness of the people, of our neighbors, right? Neighbors who just cared for each other, who came to each other's rescue, right? You had older residents of Chester County who were afraid to go to the grocery store during the pandemic, and their younger neighbors, myself included, offered to go do their grocery shopping for them. And just watching people come together in that moment was really beautiful. It was a scary time, but there was light in that darkness. And so I think that's something that was a pleasant surprise.
That's very nice.
I'll give a specific answer. I was surprised the first time we did a vaccine event, and we did it at Westchester University in the gymnasium on South Campus, and there were young people in line who didn't appear and likely didn't have pre-existing conditions, who found the QR codes and were standing in line. I went, oh man, you know, this is for frontline workers, this is for nurses. One person I recognized, and I was like, I didn't see it in a pandemic where seniors were so at risk of contracting COVID-19 and being hurt by it that you'd see people, and I recognized one of them, jump in line and try to get a vaccine first. That's not something I expected, and it changed the way when we had our next meeting with our health director and our board. We said we got to get around this. We can't have QR codes on Facebook anymore. We need to have a system where we can get people scheduled and get the right people the vaccines as quickly as possible.
Dave?
Real easy. Essential workers. Taken for granted by a lot of us, unfortunately. Essential workers and the role that they played that we didn't think about ever. And I mean essential workers, right from the ShopRite folks to the nurses, to those who work in the nursing homes, to the teachers. How we didn't realize what the value of essential workers were. The bus drivers. And these are the jobs that we're having a hard time filling again now. And so I think a lot of us took for granted the role of essential workers in our communities. And that those essential workers were so important and so critical and so necessary to just the basic operations of life. And I think that was the most surprising.
They're tough questions, but that brought to mind my feeling was the panic. To see people fighting over rolls of toilet paper in stores and stuff, the panic created by that. I'm putting my answer in. I'm not running. All right. The next question is, how much can you do to support freestanding clinics in the area, such as community volunteers in medicine, La Comunidad, I can't pronounce that, La Comunidad Hispana, so forth, for the uninsured?
Yeah, I think we could do whatever they ask of us, and we can network with them. We could work with our NGOs. I've said this all night. I think our non-government organizations oftentimes do things much better than the bureaucracy of government. They do it better, they do it cheaper, and they know what those folks need on the ground. What you need in Kennett isn't what you need necessarily in Coventry. What you need in Tredyffrin isn't what you need in Parksburg. And those local groups, whichever ones are in the rest of the question, those groups know what's best. We can help them where we can give them funding and money if they are deemed to be reliable and vetted, and we can help them in that regard, and we can help them to make sure that they are sustained in their community, and we could work with them as well as partners, bring them to the table and ownership within the community.
I consider CBIM an institution that we should be extraordinarily proud of here in Chester County. They help thousands of people that wouldn't otherwise have health care throughout our community. And we've worked with them, I think, on an annual basis to meet their needs. I meet with them annually just to chat. How's it going at CBIM? What else do you need? Is it transportation? Is it facilities? Is it dental? What's going on here that we can rally the community around to support CBIM? And in the instance of LCH, La Comunidad Hispana has the trust of the Latinx community in the southern part of the county and executes the programs they do at a very high level. You cannot find somebody who doesn't think they're doing a wonderful job, and that's because they're doing a wonderful job. And when we needed a test, COVID-19 tests for people in the agriculture community at mushroom farms because there was a spread, we would utilize them and their employees to make sure everyone got tested, and they knew we knew how to keep people safe because they trusted that provider in that community. I used to volunteer there 15 years ago when I was in college, but these are institutions that we work very closely with. In some ways, they're an extension of the government because they're helping communities that we would try to help, but we can't get to. And other ways they're completely independent because they do it about as good or better than any government agency would be able to.
I'm very proud of CBIM and the Phoenixville Free Clinic and La Comunidad Hispana. I used to be the citizenship teacher at La Comunidad Hispana. They have immigrants who are going through the naturalization process, and they got to have somebody to teach them the answers to the naturalization exam. And my wife's an immigrant; she's taken that exam, and so I used to teach there. But they do tremendous work. I think as a county commissioner, the best thing we can do for them is keep our Department of Health running as best as it possibly can, and then also just help them get access to whatever funding is available when that funding becomes available, right? Be that intermediary to help them get those grants that they ask for so that they can keep doing what they are really good at doing. So just helping them get the money that they need.
I would just, add, I think that Josh covered it, I would just add, put a fine point on it, that we do give grants to all of those agencies. And the volunteer base of CVIM with the doctors and nurses that come in, the dentists, they come in and volunteer their time is just incredible. It is community in action. And we are happy to support these organizations, and we do.
Beautiful. I'm going to throw my own question here.
Uh-oh,
Just
now
so
we're
I
in
don't have a
trouble.
card. Yeah. Guns.
Guns.
You can't turn on the TV any day and not see how many people are getting killed every day in or Philadelphia, but the region from this. I know there are strict laws and constitutional rights that create problems, but what, if anything, can be done to help stem that in this area?
Me?
All right. Yeah.
So, I'm a strong advocate that we should not have automatic weapons. There's no need for them here. These AR-15s, there's just no reason that a community needs those at all. We work a lot with the organizations that work to change legislation. We cannot change legislation. That's not what we can do. But I will tell you, you know it, you see it. It is a problem, and if we don't do something, we're going to have kids growing up just killing one another. That is just so inhumane and not who I want to be and not where I want to live. We have got to get a handle on this because it's gotten out of hand. You walk in the city, you go into Temple Hospital, the hospitals in the city, and you see gunshot wounds, kids with gunshot wounds. SEPTA, I'm on the board of SEPTA. We are always having an issue with shootings, senseless shootings, because people don't talk to one another. They just pull out a gun or pull out a knife, and it has got to stop. Don't even get me started. It's just, it's something I'm passionate about.
There's a problem. Yeah, Eric.
So as a county commissioner, I could not make laws, right? I couldn't make gun laws, but I have been a legislator before. So let me tell you what I have done on this issue. So in 2018, I co-sponsored and passed a bill, a domestic violence bill, and what it did is it addressed two separate problems that Pennsylvania was facing. So under previous law, under the Protection from Abuse law, if you were accused of domestic violence and someone got an emergency protective order against you, you had 60 days to hand over the firearms that you had in your possession. That clock started ticking once an emergency PFA was issued against you. Two problems with that. The first is 60 days is a long time, and people were dying in those 60 days at the hands of their intimate partner. The other thing, the other problem is you had innocent people being accused of domestic violence who may or may not have actually committed it, but they were losing their firearms in that time, which is a constitutional right, both in the state and the federal constitutions. What this bill did was it said that clock does not start ticking at the emergency PFA, it starts ticking at the final PFA. So you've had your day in court, you've had an opportunity to prove your innocence and appeal it, and after all of that, it has been shown that no, in fact, you did commit domestic violence. You don't have 60 days anymore. You have 24 hours, and it can't be to your brother next door. It needs to be to a police officer or a court officer or your attorney. So what that did was it improved our due process rights while also saving the lives of women, right? Too often when we talk about guns, it's the left versus the right, and there's no willingness to converse and listen to the other side. I've lived this where we actually came together in a bipartisan fashion and solved two problems with one bill, one piece of legislation. The Republican legislature passed it, the Democratic governor signed it into law. I'm proud of that.
Thank you. Josh?
Yeah, this is something, the more it's on TV and we see things in cities and things like that, people are starting to focus in Chester County. A community doesn't typically have a lot of gun deaths. Used to be one a year, possibly something like that. Could be a drug issue. Oftentimes, and increasingly so, it's domestic violence. It's someone walking through a PFA, using a ghost gun, something like that. There's not a tremendous amount of things we could do in this effort, but regarding gun violence, I think everyone, every level of government has some responsibility to do something. For us, we have wonderful investigators and county detectives. And when we see gun deaths right now, the thing that they're most worried about are these ghost guns. Being able to assemble them, they're not tracked, there's no way to background check these people before they get them. Coastal is an accidental death from a ghost gun, where a young man shot another young man, was taken to Berrien Hospital, and was declared deceased there with a ghost gun. So we need to work with all of our partners, specifically our law enforcement community and our detectives, to make sure they're going out and finding these guns that should not be on the street, making sure we're confiscating them. Now a lot of folks do these things on their phone, doing these things digitally, and one of the things we stepped up actually at the request of the district attorney was hiring more forensic folks who can look at these digital traces and find people doing a lot illegal activity, and making sure that we can get to them before they can use these things in an inappropriate or harmful way.
Thank you. David?
Yeah, it's illegal activity. I don't know any firearm owner who is not the utmost responsible citizen with their firearm. You have a Second Amendment to the Constitution. If that's something we don't like, there's a process to change that. There's an amendment process. There's also a Pennsylvania, as stated, Constitution. I think the problem is that we have a real situation in the United States, in Chester County, in Pennsylvania, where the value of life is zero. The value of life has been wasted and whittled down to nothing. We have crime and illegal weapons, and these are all working with law enforcement, and law enforcement knows this, and if you talk to them, they get it. There is such a little value of life that people place on someone else that the killing of somebody with a firearm or any other weapon, or other than a firearm, as we saw with the other issue with the prisoner, is just, the morality of it is zero. The morality is zero. So as commissioners, right, we can't change the U.S. Constitution, we can't change the PA Constitution, but you know, we can support our law enforcement, we can make sure we have the proper detectives, but what we have is a climate in the country that is very negative. And the value of life, in my opinion, has become throwaway. And that's very sad. It's very upsetting that life is so regarded, whatever, that I'll shoot and kill you just for your telephone or your car. And that is a big picture problem that all of us in the county, doctors, politicians, teachers, all of us have a duty, houses of worship, to make a change for the better through volunteer, through service, and through exemplify. It's been a long day. I taught today. What's the word? Exemplifying? Exemplifying, being a role model of civility, but also of compassion.
Okay, very good. Thanks. Here's another one that I don't know how much you can do much about, but it says, Chester County air quality needs to improve and impacts respiratory and other illness. What would you do to help decrease the pollution problem?
Too much development. We have too much development. Our roads are saturated. The county is changed in the last 10 years especially. We are overdeveloped beyond. 535,000 people and some change in the last census. What's the proper amount in the county? Are we trying to be 1 million? Are we trying to be 800,000? I don't know. I hope not. So the pollution, the air quality, you have cars sitting like me on the 30 bypass. Or Route 100 or Westchester Pike, that's not helpful. And so I think overall, it's a part of a bigger picture that we have a road system that is beyond antiquated. Let's go back to President Dwight D. Eisenhower and the interstate system, and it just doesn't work anymore. And so we have also too many cars, too many in one small of an area in the county, especially the more urbanized parts of the county. And it's a situation that is only getting worse. And it's also a mental health issue, as we spoke about before the seminar, that people are stressed in their commutes, and they get to work and they're already kind of afraid from sitting on a road for an hour. It's a health problem as well.
Very good, Josh.
This is something we're pursuing very aggressively in county government right now since we adopted our climate action plan just 2 years ago. We set up an energy and environmental advisory board made up of experts throughout Chester County from very different backgrounds to advise us on what's appropriate and how we can best affect air quality and improve air quality here in the county. One small thing we did, we went out and got a grant to start putting up EV stations at county parks. Folks who don't have driveways or garages who maybe be interested in buying an EV or a used EV, having someplace nearby where you can charge that. Maybe go for a walk at one of our wonderful county parks on Saturday, you can charge your EV. So we're start doing those things around the county. We try to do 2 or 3 things every year when it comes to doing environmental policy, things that 80% or 100% of Chester County can rally around. One of the things I think we're both, Mary and I, are particularly proud of is how much we invest in preservation of farms and open space in this county. We're over 30% preserved open space in Chester County, which is larger than the entire size of Philadelphia and the entire size of Pittsburgh combined. So we're going out to try and get ahead of these developers, making sure we're preserving areas that are thoroughfares for trails and hiking from Kennett Square to Westchester Borough and back. Something I'm proud of is our Complete Streets program. Something we adopted last year where we're going to start retrofitting our roads and make them safe for people to ride bikes on, ride scooters, walk, and or drive. Picture roads like Route 3 or 30 Business in some areas where we can start fixing these roads and have those right-of-ways safe for cyclists. We see all the time, way too often, someone get hurt on the side of the road riding a bicycle. So you see communications start to go up from us on billboards, things like that, about educating folks on how to ride safely. We had so I'm just going to leave it there. I want to make sure I leave something for my partner.
Art?
C Pacer.
So I'm proud to have the endorsement of the Sierra Club, and I'll just tell you what I told them. The more cars that we have on the roads, the more emissions that you're going to have to breathe in, and we're one of the fastest growing counties in Greater Philadelphia, if not the fastest growing county. And so the way around that is to have better transportation options, right? If you can take a train to work as opposed to your vehicle, I don't expect everybody to drive a Prius like me, right? I don't expect everybody to drive a Tesla, but if you can maybe take the train into the city if you work in the city or somewhere else, or maybe you take a bus or whatever public transportation options are out there, if we can make them easier to access for people, then there are fewer emissions on the roads and cleaner air for all of us to breathe.
Mary?
So on top of our climate action plan, which we both are very passionate about, and we have a lot of goals and metrics in there, we also work on a lot of transportation issues. I'm particularly passionate about a train that's hopefully will go from Reading to Pottstown to Phoenixville to the city and then on to New York. It will hopefully take off a lot of cars off 422, which that alone will do some good work to the air quality, but also looking at other ways. We're looking at micro transit in the southern part of the county with TMAC, and we're looking at hopefully increasing some of the SEPTA stops. Coatesville doesn't have a SEPTA stop. We're working on that. So I think that transportation, the more transportation we can get out here, the more our air quality will improve. And I will tell you, I grew up in the city, so when I came out here, it was like a transportation desert. There was just nothing around. And there isn't much more, but there is a lot in the process, and I feel really good about where that could take us. I think if we just look at some major arteries and try to focus on them to get those cars off the road, we'll be a lot better.
Thank you. All right, it's now just a few minutes before 8 o'clock. I'm going to draw this to conclusion. The plan is that maybe for a half an hour or so, if you can stay around if you want to informally ask any other questions and you're able to stay, that would be wonderful. I think the answers were very well thought out, and it's going to be a tough tough choice come election time, I can tell you that, but I wish luck to all of you. I'd like to thank you all for coming. I'd like to thank you for coming, and especially Lynn, who, I don't see where Lynn is, and Christina, who really, to say they did the lion's share of the work would be a vast understatement. They really did everything.
Thank you for
Appreciate
having
that.
us. Thank you.
Go Phillies.
Go Phillies.
Yeah.